In the year of 1896 in France, Dr. Antoine Marfan, who is a pediatrician, had identified a 5-year-old girl that suffered from arachnodactyly. It was then named after him, called Marfan Syndrome. It took about 50 years to completely explain this disorder. But first, what is Marfan Syndrome? Marfan Syndrome is an inherited disorder affecting connective tissues in the body. The connective tissue provides strength and flexibility to structures such as bones, muscles, blood vessels, and heart valves. Therefore, Marfan syndrome can cause abnormalities and affect many systems in the human body. There are two primary features of this syndrome. The first one is vision problems caused by dislocated lens in one or both eyes called ectopia lentis. The second one is defects in the aorta that distributes blood from the heart to the rest of the body. The aorta can weaken and stretch, which may lead to aneurysm, a bulge in the blood vessel wall. The stretching of the aorta can also cause aortic valve to leak, which may lead to aortic dissection. Overall, aortic aneurysm and dissection can be fatal. The symptoms and severity of Marfan syndrome vary from patient to patient, even among members of the same family. In most cases, the symptoms progress as a person ages. The signs and symptoms may include disproportionately long arms, fingers and legs, extremely tall and slender build, a breastbone that protrudes outward or dips inward, heart murmurs, a high arched palate and crowded teeth, dislocation of the eyelids, scoliosis, extreme nearsightedness, flat feet, and lastly, flexible joints. There is currently no cure for Marfan syndrome. However, treatments can help delay or prevent complications, especially when started early. The medications involved are beta blockers, angiotensin receptor blockers, calcium channel blockers, and angiotensin-converting enzyme inhibitors. These medications help in reducing blood pressure to prevent the aorta from expanding and reduce the risk of dissection and rupture. The vision problems associated with dislocated lens often can be corrected with glasses or contact lenses. Aortic repair. There are some cases when the diameter of the aorta rapidly enlarges about 2 inches. Doctors may have to conduct an operation. This operation involves replacing a portion of the aorta with a synthetic tube to prevent an aortic rupture that can potentially be life-threatening. Scoliosis treatment. Scoliosis can be treated operatively or non-operatively based on the size and the severity of the scoliosis. It is also important to have a consultation with a spine specialist, as they may conduct a specific physical therapy. Eye surgeries. A surgery repair can be conducted if the part of the retina is torn or come loose from the back of the eyes. Breastbone corrections. Pectus excavatum repair, where it involves surgery that uses a temporary metal bar to push the sternum out to reform it into a more correct position. Marfan syndrome is a genetic condition caused by a mutation. These mutations cause changes in one of the genes called the fibrillin-1 gene, located on the 15th chromosome pair. Genes are located on chromosomes and contain recipes to make proteins. The protein made by the fibrillin-1 gene functions as a major building block of connective tissues. Absence or deficiency of the protein results in weakening of the structures of various organs. Hence, the possibility of this disorder to be cured is slim to none. Marfan syndrome follows an autosomal dominant pattern of inheritance. This means only one copy of the changed gene is needed to result in the condition. A parent passes on one from each pair of their chromosomes to each child. Which one they pass on is down to chance. There are therefore 4 possible combinations of chromosomes that the children of this couple could inherit. When a child inherits the chromosome with the altered gene, he or she has the condition associated with this gene variant. When a child inherits the chromosome with the usual gene from their parent who has Marfan syndrome, they will not develop the genetic condition and cannot pass the altered copy of the gene to their children. Hence, these are the 4 possible outcomes. How common is the disorder? Marfan syndrome is one of the most common inherited disorders of the connective tissue. Marfan syndrome occurs 1 in 5,000 to 10,000 individuals in the general population. In the United States, it was suggested that the estimation of people having this disorder or a related connective tissue disorder is at least 200,000 people. Regardless of geography or ethnicity, Marfan syndrome affects both genders, male and female equally of all races globally. The average lifespan of a person with Marfan syndrome is 70 years. However, a person with Marfan syndrome may live for a normal lifespan, which is 60 to 80 years if they are early diagnosed, has proper lifestyles, and receive suitable medical and surgical management. Based on studies, women with Marfan syndrome generally tend to live longer than men with Marfan syndrome. A study was performed in Wales and Scotland, and it was found that the median survival age for male patients is 53 years and the female patients is 72 years. In about 75% of the total cases has reported that this abnormal gene is inherited from a parent who is affected. The chance of each child of an affected parent to have the disorder is 50% in an autosomal dominant pattern, which means one copy of the altered gene in each cell is enough to cause the disorder. The family members will be emotionally affected. The fact that the medical cure may not exist to treat the child with the disorder often makes them concerned about their ability to take care of their child. They will also be financially affected. The financial cost of the treatments that are needed by the affected family member may add burden on other family members, especially those from a low-income family. The financial strains felt by family members of patients often lead to stress and worry. Frequently asked questions. If no members of my family are affected by Marfan syndrome, can I still have a child with the condition? The answer is yes. The majority of cases of Marfan syndrome occur in families with a history of the condition previously reported. However, spontaneous mutations account for up to 30% of all Marfan syndrome cases. The genetic change occurs randomly and the cause of it is unknown. Since Marfan syndrome is a genetic condition, is it possible to have more than one child with the condition? The answer is yes. If either or both parents have the condition, the associated risks apply to each pregnancy. Recurrence of Marfan syndrome in a family where there is no family history of the condition is low. What are the main medical issues faced by people with Marfan syndrome? The most prevalent problem faced by Marfan syndrome patients is complications involving the cardiovascular system. This requires patients to undergo regular cardiac monitoring and refraining from pursuing strenuous activities. Fun facts. Abraham Lincoln, the 16th President of the United States, was suspected to have Marfan syndrome because of his tall and lanky physical appearance. Lincoln did have a genetic disorder passed to him in an autosomal dominant fashion from his mother. Pulling a tooth from someone with Marfan syndrome could kill them. Infections can set in very quickly with someone who has this genetic disorder, especially if the connective tissues of the heart valves are involved. Marfan Awareness Day of Giving is on February 15 to support the Foundation's education and awareness programs. From this research, I have learned that this disorder can be avoided as it is inherited from affected parents. However, you can live normally like other people if you are diagnosed earlier and receive proper medication. Besides, to avoid any complications, you should avoid certain physical activities which include contact sports, intense physical activity, and weightlifting. Marfan syndrome is not curable. However, doctors can suggest suitable treatments to delay or prevent complications and treat the symptoms of the disorder. In conclusion, it is impossible for a person to avoid Marfan syndrome as it is an inherited disorder. If you have a known family history of Marfan syndrome, you may want to have genetic screening to find the condition early, and if you have been diagnosed with Marfan syndrome, you should follow your treatment plan, practice a healthy lifestyle, and get mental health support.